So, listen up, guys. We've got a patient here with some unusual symptoms. The first one's photophthalmia, then there's Thaler's disease, and finally non-gonococcal urethritis.
I think it sounds more like a case of hemophilia to me.
No way, I'm pretty sure that's just hyperventilation. We've seen worse.
Well, I reckon you're both wrong, but not for the reason you two are thinking. I believe we're looking at a case of ectoderma pigmentosum here.
Alright, listen up, guys. It ain't hemophilia, hyperventilation, or ectoderma pigmentosum. It's X-linked recessive hypoparathyroidism.
What? How can you be so sure?
I don't get it. We've studied this stuff before, but I'm not seeing the connection.
Me neither? What makes you say that, Hawks?
Because it's my diagnosis and we're doing surgery. Disectomy to be exact, which is risky for sure. But sometimes you gotta do what you gotta do to save a life. So let's get on with it, shall we? So, you don't think I know what I'm doing, huh?
No, Hawks, I definitely believe in your abilities, but sometimes you're wrong.
Well, this time I'm not. My patient has X-linked recessive hypoparathyroidism, and disectomy is the best course of action.
I have seen enough data to question that assumption.
This is not about your past experiences, Tracy. It's about my present knowledge.
And yet you still don't understand why I can't just let you do what you want, Hawks.
Because this time I'm right. Trust me, trust in my judgment.
I've trusted you before and got burned.
It's not my fault you moved when I told you where the wax was dripping.
No, I mean about the fact you exaggerated the size of something you were quite proud of after you hyped it up for one disastrous evening.
Oh, dear heavens, I can see that things have taken a turn for the worse here.
I agree, Randall. Disectomy was not the right choice for this patient's condition. Dr. Hawks might want to reconsider his approach with X-linked recessive hypoparathyroidism.
Absolutely, Frank. We need to find the correct treatment as soon as possible. The patient is in critical condition and needs our full attention. Let's discuss our options. Perhaps there could be another type of surgery or a different medication that would yield better results.
Yeah, Randall, let's think outside of the box here. Maybe we can find an unconventional treatment method that could solve this problem without endangering the patient further.
You're always full of ideas, Frank, but let's ensure they're based on medical knowledge and not sheer luck. This is a serious situation and we need to be cautious with our decisions.
Of course, Randall, I understand. Let's make sure whatever treatment we decide upon would do the patient more good than harm.
Exactly, Frank. Now let's get back to it. We have work to do and a patient counting on us.
You middle school flunkies, did you not learn a thing from that fiasco? You nearly killed your patient with your incompetence.
But Hawks, we were just following the protocol for X-linked recessive hypoparathyroidism. We had no reason to suspect it wasn't the correct diagnosis.
I mean, even if there was a mistake, disectomy is standard procedure for that disorder. It's not like you told us what to look out for or suggested an alternative approach.
Look, Hawks, we're sorry things went wrong, but can we at least try to figure this out together? We've got a patient who needs help.
You people are idiots. You didn't even question the diagnosis when I told you it seemed off. That poor man could be dead or suffering severe side effects, and all because of your laziness.
But Hawks.
Shut up. You're all fired on the spot for this debacle.
What are you saying?
Forget it, Frank. We flunked middle school. Hawks is admitting he's unqualified to teach us what he means.
I'm saying that you three have no place in my clinic after today. I trusted you and you let me down big time.
Wow, you finally fired them? Did they believe you?
Probably not. I've told them that one a few times and they still don't understand what I mean. I must admit, your passion for oncology is inspiring, but I do believe we're missing something.
What could that be? I've spent years studying the field.
Oh, nothing specific to the study. It's just a gut feeling I get from some of my patients.
Well, whatever it is, let me know when you figure it out. Maybe there's something we can learn together.
Actually, I believe I've figured it out now.
What? What did you find out?
I think the key to understanding this case lies in. Hawks pauses and looks away.
Don't read that part.
Sorry, Johnson. It's not that I don't value our friendship, but I believe my duty as a doctor comes first.
Johnson jumps out of the window into oncoming traffic.
I know you're all upset that I barged in here without proper protective gear, but time's a ticking and we've got lives at stake.
We can't take risks just because you think you have the answers. You need to be safe out there too.
We appreciate your enthusiasm, Hawks, but we also need to respect procedures and protocols.
You're putting all of our safety at risk with this kind of behavior. We need to ensure everyone's, well, being.
I understand your concerns, but I'm telling you now, the diagnosis for these patients isn't X-linked recessive hypoparathyroidism. It's carnitine acylcarnitine translocase deficiency, and that's not a typo. I figured it out during lunch with Johnson.
That's quite an assumption to make, Hawks. We need concrete evidence, not just guesses based on lunch conversations.
We're going by the book here. You'll have to follow protocol too if you want your opinion considered.
You can't just storm into an operating room without any sort of preparation, Hawks.
That's reckless, and we can't condone that behavior.
The Hawks ignores them angrily.
Well done, Hawks. I must admit, you really went the extra mile to get it right.
Oh, shut up, Tracy. Like my life isn't hard enough without having idiotic doctors work for me.
And what are you suggesting by that, Hawks? That your performance was somehow better than your team's?
My performance has always been better than my team's.
That's not what I heard from that nurse you went out with.
Didn't know she would open up to someone with more ex-husbands than a farm with a high turnover rate.
What does that even mean, Hawks? Are you confusing husbands with husbandry?
Oh, come on, I thought you would appreciate that pun, being raised in a barn and all.
Let's get back on topic. How about you stop trying to shift the blame and take responsibility for your actions?
Take responsible for my own actions. Why not just call me a fool too?
There's no need. Your inability to continue beyond a one-night stand with any relationship has spoken for itself.
There's you bringing up that nurse again. That's rich coming from someone on their fourth husband now. She should talk with Chaplain John to see whether that's grounds for damnation.
Since when are you the enforcer of morality?
Someone's gotta set standards in this hospital. I don't see you doing that anytime soon.
This attempt to get a rise out of me isn't working.
I think it's because we're still on the clock, and this isn't nearly as funny to anyone else listening in on this conversation. How about we continue this discussion over dinner, then maybe at your place afterwards?
Oh, what the hell? Anyone listening is probably demanding for us to just get a room and fuck.